Hello everyone. We as Koç University Hospital can perform kidney transplantation by robotic surgery. We host patients in need of kidney transplantations from many countries of the world in our hospital. To discuss this topic, we are with Professor Dr. Burak Koçak from Professor Dr. Münci Kolayoğlu Organ Transplantation Center. It's a point of honor our patients from many countries of the world prefer our hospital and come with their donors. From which countries do the patients come most?
We have a lot of patients coming from foreign countries, but I would say mostly the Balkan Peninsula, Bulgaria and Kosovo, Bosnia and Herzegovina, Macedonia, and we also have a lot of patients coming from Central Asian countries like Uzbekistan, Kyrgyzstan, Kazakhstan, and we have patients coming from Middle East and North Africa too.
Thanks to robotic surgery, the patients can be discharged in a shorter period and get back to their social life. Their recovery period is quicker. This is one of the reasons why our international patients choose us. What will you say about this?
Koç University Hospital is the only center in Turkey performing robot-assisted kidney transplantation at the moment. And in the last decade, this surgery is coming more and more popular, and we have reached a considerable amount of experience with this surgery, and now we are offering robotic kidney transplantation to our foreign patients. Robotic surgery has many advantages from the patient side and the surgeon side, and it brings you all the advantages of a minimally invasive surgery. You are performing the surgery with a robot with tiny holes from the abdomen, so it's cosmetically superior compared to open surgery, and you can perform the surgery from tiny holes and a very little incision that you made in the abdomen. The patients experience less pain compared to open surgery, stay shorter in the hospital, and the convalescence period is shorter compared to open surgery, and they can go back to their work and daily life shorter compared to open surgery. So briefly, it brings all the advantages of the minimally invasive surgery to kidney transplantation. The robot brings a lot of advantage for the surgeon too. So you perform the operation while you are sitting, and it magnifies the operative field 16 times more, and the robot has tiny instruments with very precise tips, so it can perform extended maneuvers during the surgery, and it brings you to reach spaces in the patient's cavity where it is difficult to reach anatomically. And the robot senses the basal tremor of the surgeon, it erases it, and it only does the major movements you do while you are operating the console. So I would say shortly that the robot helps the surgeon to, makes the surgery more excellent and perfect.
You told that our country ranks first in the world in transplantations from living donors. Our experience in this is great. What are the differences between living donor and cadaver surgery?
Cadaveric transplantation is an operation that you perform in emergency conditions, but for the living-related surgery, you can work up the donor and the recipient precisely, and then you can schedule the operation. So it's, I would say, a safer operation because you will work up the donor and the recipient the way you want in a considerable amount of time, and you will perform the surgery whenever you feel like the donor and the recipient are ready for the operation. The second most important thing is that the living donors live longer compared to cadaveric donors. Generally, the half-life of a kidney from a cadaveric donor is around 8 to 9 years, but the half-life of a living-related donor is around 15 years. So the living donor kidneys live longer compared to cadaveric donors.
How does the kidney transplantation process happens in diabetic patients?
If you look at the developed countries and the developing countries, the first reason for a kidney renal failure is diabetes. Then comes hypertension, and the third is the glomerulonephritis, the inflammation of the kidney. So 30% of our patients are diabetic patients. So the abundant amount of patients that we transplant are diabetic patients. So they are not different than any other patients that we transplant for chronic renal failure. But the diabetic patients have some important issues that you have to, be careful when you are doing the workup. The first is the cardiac status. The diabetic patients who have renal failure have 30 times more risk of developing coronary artery disease compared to regular renal failure patients. So the cardiac evaluation is very important. In most of those patients, we do a cardiac catheterization before the transplant to be sure that their heart is okay to go under a transplant. Second is the calcification of the vessels. The vessels could be diseased in diabetic patients, so we get a CT scan before the transplant to be sure that the vessels are in good condition where we are going to solve the kidney vessels. So if you pay attention to these important points and do the workup of the diabetic patients in a good way, then the results of the kidney transplants are perfect as the other group of patients. And I would like to mention this, the most important group of patients that get benefit most from the kidney transplant is the diabetic patients. So if you need to do a kidney transplant to a patient, that should be a diabetic patient because they benefit more than any other patient. So you need to try to transplant diabetic patients as much as possible.
What is cross-transplantation and in what situations do you prefer to use it?
Well, sometimes the donor and the recipient have blood group incompatibility. So the donor of the patient can't donate to their own recipient. So we can do a paired exchange transplant with another pair which are carrying the same condition. So say one donor is A and the recipient is B, and the other pair, the donor is B, the recipient is A. So the first donor can donate to the second recipient and the second donor can donate to the first recipient. Plus some donors, the recipients are immunologically reactive to their donor, so it's impossible to go and transplant them. So with paired exchange donation, we can find them pairs, donors, that they do not react. So when we mix them in a pool, say patients with blood group incompatibility, patients with HLA incompatibility, or immunologically not compatible patients, we can find possible donors with the pairs, and we can go and do a paired exchange donation and get these patients transplanted.
How does the process continues in kidney transplantation patients with blood incompatibility?
There are two options. One is a paired exchange donation. We can find donors who are compatible for the recipient, and they can go and get a paired exchange donation with their compatible donor, so we can overcome this blood group incompatibility. And there is another form of doing blood group incompatible transplants with some form of treatment. Let's say the donor is blood group A and the recipient is blood group 0. We can go and do a treatment called plasmapheresis, and remove the antibodies in the recipient reacting to the donor. After this treatment, when the recipient is ready for a safe transplant, we can go and transplant these patients from their own donors. And the success rate of an ABO incompatible transplant with this treatment modality is the same with a regular blood compatible transplant. So the success rate is almost the same with normal kidney transplants.
Can you give detailed information about the donor's post-operative process?
Well, the donor operation is done laparoscopically, so it's a minimally invasive operation. We just do 2 or 3 tiny holes in the abdomen of the patient, and when the operation is over, we remove the kidney through a 6 centimeter incision in the lower abdomen, like a cesarean C-section incision or an inguinal hernia repair incision. After the transplant, after the donor operation, when we move the patients to the floor, they start drinking water. At 6 o'clock in the afternoon, they start to eat, and after their dinner, we have them walk around, and next morning they start to eat and drink normally. So if the donor feels well, we let them go home next day, or they want to stay one more day. Generally, they stay one more day, and the day after surgery, like 2 days after the surgery, then we discharge them home. And we ask them to come for a follow-up visit 1 week after the surgery, 3 months after the surgery, and then we check them every year. After the transplant, for 4 to 6 weeks, we ask them not to lift heavy weight, not more than 10 kilograms, or do heavy exercise. But it's okay for them, to walk around, do daily activities. But after 6 weeks, they're allowed to do everything. If they do like an workout, gym, exercise, they can go back and start doing it after 6 weeks. And generally, they can start driving in 1 to 2 weeks after the surgery. And generally in 3 weeks, they go back to their work and regular life. They don't need to change anything after the donor operation. They don't need to do a diet, and they don't need to take any medications, and they can live the way they lived before the donor operation.
Who can be a donor in kidney transplantation surgery?
Legally, people who are 18 years old can donate. Of course, we do a regular workup, a detailed workup for the donor. If we find out that they are healthy, then they can go and donate. In our country, people up to 4th degree relatives can donate. And for example, the recipient's wife's up to 4th degree relative can donate too. Other than that, relatives beyond 4th degree or friends, close friends, we have an ethics committee, and we send the donor to the ethics committee, and the ethics committee, if the ethics committee approve, then they can also go and donate for their recipients.
Before ending our conversation, do you have any message to our audience on how to keep their kidneys healthy?
I think the major thing is to eat less salt. I would recommend them to eat less than 2 grams a day. Drink water, eat healthy. I think that would help, and don't smoke.
We thank you for all the valuable information you shared.
Sure, thank you for the opportunity to express my thoughts with our patients.
Thank you for watching us, and do not forget to follow our social media accounts for our following videos.